everyone. This is Dr. Aysha, one of the mentors of StudyMRCOG. I hope the previous recording of maternal medicine and antenatal care was helpful for you all. Today we have come up with gynecology module. Hope this module and how to go about it will help all of you. So we always start with a quote of the day. Don't let a bad day make you feel like you have a bad life. So there is always a good start on a good day. So in the gynecology module, the questions will be either patient-simulated task, structured discussion, teaching task, or a pre-op gynecology rounds. You have to get prepared for all of these. And these tasks will be assessing the domains: patient safety, information gathering, communication with the patient, applied clinical knowledge, and also communication with colleagues. This module covers a variety of gynecological problems, both elective and emergency. These assessments, as I've told you earlier, will cover the 5 domains. Since gynecological exposure for trainees is limited, but it is expected that an average ST5 would be able to manage most emergencies independently, but some of the uncommon gynecological problems, applied clinical knowledge would be assessed. Now let's see what are the types of tasks that are assessed in gynecology module. It includes menstrual disorders. Either it could be primary or secondary amenorrhea, it could be dysmenorrhea, irregular periods, and oligomenorrhea. Or it could be development abnormalities of the genital tract, including congenital malformation like MRKH, or even it could be AIS. In this type of station, it's usually a lay examiner tested task, where you have to be sympathetic, or empathy shows empathy towards the, a teenager coming with no periods at all. It could be pediatric and adolescent gynecology, including puberty and pubertal disorders. Again, they can come with puberty menorrhagia. Or it could be some of the girls coming with the labia defect or something like that. They would ask for some cosmetic surgery. So this type of task will also involve lay examiner. How you will communicate with these young girls is the one assessed in such type of task. General gynecological endocrine disorders like PCOS. This is also the most commonly worrying factor for the young girls nowadays. So this can also be a task for you. Emergency gynecology like adnexal accidents, cystortion, or miscarriages, or ectopic pregnancy. Either these type of tasks, involve 1 or 2 modules together. Miscarriages and ectopic pregnancy could also be there in early pregnancy module 2. Menopause and hormone replacement therapy. A patient coming with hot flushes and asking for HRT. Pelvic pain, vaginismus, endometriosis. Vaginal discharge, PID. Benign tumors like fibroids and ovarian cyst. Either it could be to diagnose, or a fibroid lady coming with infertility. So again, here 2 modules are involved. Ectopic or non-cancerous vulval disease. Rape and forensic gynecology. This can come as SPT or a teaching task. Gynecology pre-op rounds can come as structured discussion. Domestic violence as a hidden agenda in any of these stations. Most commonly, it would be either pelvic pain or vaginismus or vaginal discharge coming repeatedly to you. Now let's see how the template of gynecology station should go. If it is a structured discussion, always start with S-bar format. S-bar is for situation, background, assessment, and recommendation. Then you answer all the questions that are posed by the consultant. In an SPT, that is patient simulated task, always introduce yourself. Suppose if it is like a mild BBN where they are coming with the biopsy reports, try not to be too much excited. You have to show empathy in the beginning itself. Introduce yourself like, "Hi, I'm Dr. So-and-so in the gynecology clinic today. How can I help you?" Agenda is that I can see that there's something worrying you, or I can see that you have come here to discuss the report. May I know some of the questions that is related to you so that it will help me in understanding you better? Or do you want me to discuss the report with you first? So such type of agenda you should make so that the patient or the role player is comfortable with you. Now, in the gynecologic module, what are the history that you're supposed to elicit? That is history of presenting illness, irregular periods, intermenstrual bleeding. Always in the gynecology module, ask about the last menstrual period. Never ever forget about that. And how is her periods, whether it is regular, how is the flow, whether associated with clots, and what day of cycle it is, and how many days of cycle does she have regularly, whether there is any intermenstrual bleeding. The other common presenting illness could be vaginal discharge. Ask about the onset, color, consistency, foul smelling. Dysmenorrhea, whether it is associated with bowel symptoms, urinary symptoms, whether the symptoms are seen in the family. Usually endometriosis is a condition that can run in families. Sexual history, always ask after signposting. How do you signpost? May I know some of the questions which are very personal? Asking these type of questions will help me in managing you better. Ask whether it is superficial or deep. Ask about postcoital bleeding too, if the patient is coming with any dyspareunia or intermenstrual bleeding. Gynec history is very important in gynecology, like smear history. Is she updated with the smears? Are the smears normal? Contraception, what type of contraception is she taking? And her last menstrual period. Obstetric history, you need to ask how many children does she have, any future fertility desire, because sometimes the patient might come with, a 30-year-old may come with irregular vaginal bleeding or heavy menstrual bleeding, where she has taken medical treatment, and if she has any fertility desire in the future, then the surgical treatment might not be suitable for her. Medical history like diabetes, any other comorbidities like hypertension or thyroid disease need to be elicited, because if the patient is undergoing any surgery, all these conditions has to be optimized before surgery. Again, family history, ask about the dysmenorrhea and as well as about the clots in the family. Surgical history, whether she had any surgeries, that what type of surgery did she have, whether it was a gynecological surgery, whether it was surgical cause for the surgery, because that will help you to plan for the type of incision, or in case of planning for laparoscopy, you know what is the mode of entry. Drug and allergies need to be asked in all stations of all modules too. Personal history, BMI, alcohol, smoking, recreational drugs need to be asked, because BMI, whether it is very low or very high, That is also risk factors for some surgeries, especially in laparoscopic surgery. And alcohol, smoking, recreational drugs will also, it's not good for the general health well-being. And also if she's undergoing any surgery, then the recovery will not be very fast. Social history and mental history is also equally important. Examination in the presence of chaperone and management according to the cause. So this is the general template of gynecology. Now, let's see how the domain works in the gynecology module. Information gathering. Whenever I take any session, I say that it's not only the history taking, it also involves examination in the presence of chaperone, interpreting the images, graphs, and investigations, and requesting investigations if required. Always ask focus history, review the present and past records if she's coming after surgery. Focus history means what? For example, a patient is coming with a vaginismus. Do we ask for blood group here? It's of not that important. What we ask is about the social history, about her family, about her partner history, and also about her sexual history after signposting. That becomes focus history in vaginismus, not about the blood group or reservation for blood transfusion. Now, if you take a patient who has completed her family and she has come with the heavy menstrual bleeding, then here her blood group and reservation for blood transfusion is very important. This is what I mean by taking focus history. Communication with the patient and relatives, it should be of a clear language, able to communicate with the patient and family about their care, including diagnosis, investigations, and management options. Always give information in chunks, understand in between. You have to know the principles of autonomy too. Patient safety. Now, you need to ask about the allergies in almost all stations because that's patient safety. Examination in the presence of chaperone. These are the most important things you need to see. Ask in almost all stations, and more so if examination is required. Able to demonstrate risk management in gynecology. Recognize your limitations and when to call for senior support. That's very, very important. Suppose there is a patient who has undergone 2 previous years and a high BMI, and she is for TAH. You will involve your consultant because you will anticipate a lot of additions in this patient to anticipate additions, and you want to avoid bladder or bowel injury, right? So in case if you are suspecting some of the injuries, then you need to call a concerned specialist. For example, if there is bowel injury, call the colorectal surgeon. If there is any bladder injury, you need to call the urologist. So always remember that you have to involve the MDT or the senior support, and whenever you anticipate there could be some risk with this patient. Always use WHO Safe Surgery Checklist. In the applied clinical knowledge, I'm sure you all have cleared the Part 2 exam and you are well versed with all the guidelines. How you apply these guidelines in these stations is what is expected in the applied clinical knowledge. CTG guidelines, NICE guidelines, TOG articles, and scientific impact paper. Will be able to use evidence critically to support decisions about care, including investigations, plan of care, and treatment options, and counseling about this. The other domain is communication with the colleagues. With the colleagues, you have to involve MDT whenever you feel the other specialty has to be involved, as I said earlier. And also involve your consultant whenever there is any swab or anything has to be taken. Involve the microbiologist. Whether blood and blood products required, involve the hematologist. So all these things you have to keep in mind, and these are the easy way to score marks in the domains. Now coming to the tricky questions. Okay, so the first question about the gynecology is a nulliparous lady experiencing premenstrual syndrome may come distressed with you with her symptoms and mood swing, requesting you to remove uterus. So how do you go about this station? So you need to, first of all, you have to be empathic towards this patient. Introduce yourself, make an agenda, and ask her what is bothering her, how it is affecting the quality of life. Whenever she is telling her all her symptoms, you have to be very empathetic and say, yes, I can see that you are very distressed. I'll see how I can help you. May I ask some questions with you? And she might not, even listen to you, and she will be repeatedly telling you that remove my uterus, remove my uterus. So how do you go with this station? So first of all, you need to tell her that removing the uterus will not help in this case. It is the ovaries which are releasing hormones, and this is those hormones, and it is those hormones that are causing all these symptoms. So we have other options for you. What are those? Now you can see that she is nulliparous lady, and she asked her whether she is planning for pregnancy. Planning a pregnancy itself will resolve the situation. And then you have to talk about the talking therapy, that is the cognitive behavior therapy, and also about the contraceptive pills or patches and gonadotropin injections, and then last resort is for surgery. So some of the tricky questions will be like that. You will be knowing all the answers, but how to go about it will be a problem. So what I suggest is that first 2 minutes you have to organize your thoughts, see how you can systematically arrange things, and then talk in the station. The second station, let's see, a postmenopausal lady is coming to you with hot flushes, and she has come to you for HRT, and she says that she is lactose intolerant. Again, here, the postmenopausal lady with hot flushes, how anxious she will be. Again, acknowledge her symptoms and tell her that yes, it is affecting the quality of your life. And what about the HRT in lactose intolerant? Because HRT contains lactose, so she will not be able to take it orally. So what are the other options for her? Yes, the patches are the one you can prescribe for her. So that will be the only trick in such type of cases. So you need to ask all the history, elicit all the history, and when you ask about the drug or other food allergies, that is the time she will say that she is lactose intolerant, and that's the time you say that yes, we cannot give her orally, we have to give patches. The third question is like Mrs. XYZ frequently visiting you with complaints of vaginal discharge, and she has taken all kinds of treatment. Swab culture shows no growth, always hurrying in consultation. What is that comes into your mind? See, always some of the vague symptoms, if a patient comes to you and asks for treatment, always think about domestic violence. Okay, their domestic violence is the hidden agenda in such type of stations. No eye-to-eye contact, hurrying in consultation, vague symptoms, always go towards domestic violence. Then your stations will go towards domestic violence, how we will safeguard her. The fourth question, Mrs. XYZ is referred from GPs to discuss the biopsy report. Biopsy was taken because of vulval itching and skin changes. Here in this station, it will be a MyBBN, and look for risk factors always. So in such type of stations, either the patient will be HIV positive or she will be smoker. Ask how many cigarettes will be she smoking. It will be more than 15 or 20 cigarettes. So cutting down that, and HIV positive patient taking whether she is on correct treatment, because immunocompromised situation can worsen this condition. So you have to make a mild BBN, elicit the risk factors, and tell her about the diagnosis and the treatment that is there for her. Gynecological rounds is another stations that can come to you with 3 or 4 or 5 cases with you. Always make a blanket statement for all the stations, like you would check whether the patient is in the reproductive age group. If the patient is in the reproductive age group, exclude pregnancy, first do a UPT, and then you see whether what type of treatment she is taking for the condition and whether she is on OC pills, on hormone treatments. If she is on hormone treatments, you have to stop it at least 4 weeks before the surgery and check for the consent and see for any allergies. If any of the patient has any latex allergy, then she will be the first one to be in the list. And then you see whether any complicated cases, because complicated cases you will do first, because if you need any help, the help is around there during the early hours of morning. WHO's surgical checklist has to be followed. So you make a blanket statement for all the stations and then go one by one to all the rooms. So we finished we talked about the types of stations. And now let's see how you make a last minute revision. What I suggest is that you go through all the flow charts of all guidelines and boxes and flow charts of important talk articles. For example, here we see management of endometrial hyperplasia. Look at the flow chart: endometrial hyperplasia without atypia and with atypia. With atypia, the treatment would be total hysterectomy with or without bilateral salpingo oophorectomy, depending upon the age of the patient. Suppose if a fertility is required or surgery is contraindicated, in how many intervals would you take the biopsy? That's very important. In case of endometrial hyperplasia, it is once in 6 months, and with atypia, it is 3 months. See for the regression, persistent, and progression, and then review treatment. So in one glance, you know the whole treatment of endometrial hyperplasia. So this is how you do a last-minute revision. Again, see about the postmenopausal ovarian cyst. How would you go about the treatment? This is again a flow chart about how PMS is treated: first line, second line, third line, and fourth line. Again, heavy menstrual bleeding in adolescence. This is a flow chart from the talk article. So tips to prepare for exam. Always I say good sleep, good brain rest is always required so that your neurons would be, working very efficiently during the time of exam. Practice with role players with timer. Go through all the textbook. Try to do all the stations that are there in the textbook, because most of the cases are the recalls. Go through all charts of all guidelines. Go through boxes and charts of important talk articles. How to face exam. Good sleep before exam. As I told you, your neurons should work efficiently on the day of exam. Be calm and composed. Take a minute before you answer the question, whether it is in structured discussion or in the patient simulator. If you don't know the answer, just pause for a moment. Organize your thoughts and then speak up. Be systematic. Ask only relevant and focused history. As I mentioned earlier, do not ask for blood group in vaginismus station, and do not forget to ask in fibroid requiring surgery. Do not ask contraceptive history in postmenopausal women. And thank you and all the best for your exams. I'm sure that this gynecological overview of this module will help all of you. And we will also come with the same manner in all the modules. that is gynecology and oncology, labor and delivery, and all other modules will come up with the tips how to go about these modules. Thank you all.